Hello, my name is Svetlana Yordanova. Today I will discuss sign language and the use of manual signs as a form of augmentative and alternative communication system for individuals with autism. Manual signs have been used with individuals with autism spectrum disorder since the 1970s. Manual signs are an unaided form of alternative communication because they don't require the use of materials or devices which are external to the body of the communicator. The use of manual signs can be beneficial as a primary mode of communication for individuals who are non-vocal or have a hearing impairment, or they can be used as a supplemental communication method for persons who exhibit some spoken language but might have articulation challenges or unintelligible speech. Good motor imitation and joint attention skills are important prerequisite skills for the effective acquisition of sign language. Single-case research on the use of sign language with individuals with autism has reported favorable outcomes in developing a functional mending repertoire and improvements in speech comprehension and speech production. Benefits of manual signs include the fact that they're portable, preserve most of the characteristics of natural speech, and can be easily prompted and shaped. However, the use of manual signs has limitations as well. Manual signs are functional only if the user's communicative partners also understand and know how to communicate with signs. Likewise, sometimes individuals use idiosyncratic or modified signs, which might be difficult to interpret. Some parents fear that the use of manual signs might inhibit the development of speech in non-vocal children. However, research has not confirmed such concerns, and some studies have suggested that the use of sign language with non-vocal children with autism might in fact increase their unprompted vocal responses. In the center where I practice, we typically start sign language training by teaching a child to use manual signs to request or mend for preferred items. First, we perform a preference assessment to identify items or activities that are highly motivating to the learner. Now I will demonstrate how you can teach a child with autism to mend for items using manual signs. For example, let's assume that these cookies are a highly motivating item to the learner I'm working with, and I want to teach him or her to request for cookie by using the manual sign. What I would do is have pieces of these cookies visible and in close proximity to the learner and give them first one or two pieces to taste. As the learner has tasted the cookies and I can see that they want more of it, I will use this motivating operation to teach them how to mend for the cookie by performing the manual sign. So when I see the learner reaching and trying to grab a piece of the cookie, I would stop them and immediately prompt them to use the sign for cookie. Cookie, cookie. After I see them making an acceptable approximation of the manual sign, I will reinforce immediately by giving them a piece. I will repeat this procedure in multiple trials until the learner can mend for cookie using the manual sign independently and spontaneously. Initial mends will have to be prompted, approximations of the sign shaped, and the mends generalized to different kinds of cookies until the learner can fluently mend for the item using the manual sign for cookie. In a similar way, you can teach signs for favorite activities, for example, jump. If the child enjoys jumping or can see a trampoline and would like to jump on it, or important daily activities such as eat or drink. Sign language is also very versatile, and you can use it to teach more complex communication such as short phrases, for example, more cookie or want cookie. You can also use manual signs to teach other verbal operands such as tags or interverbals. I hope you found this video informative and that it might encourage you to try this method with some of your children and clients with autism. Thank you.